severe anemia and why it mimics cardiac symptoms on today's episode of Make It Make Sense Cardiology. For those of you who have not had the pleasure of meeting, please let me introduce myself. My name is Andrea Gibson. I am a cardiac nurse practitioner, educator, and creator of what you see right here, Make It Make Sense Cardiology. Because over the years of my practice, I have gotten tired of seeing some of the most brilliant nurses I know become increasingly frustrated and overwhelmed and even intimidated by cardiology simply because physiology hasn't been explained to them in a way that actually makes sense. And I am here to change that. Student and new graduate nurses, get ready to have your minds blown. Get ready to have your light bulb moment. Get ready to look like a rock star when you explain this phenomenon to your patients. Last week, I had a patient come and see me at the referral of her primary care doctor because she was having what seemed to be cardiac symptoms, intermittent chest pain with minimal exertion, some fatigue that was progressively worsening, even some shortness of breath that was progressively worsening in a relatively short period of time, like we're talking over the course of a couple of weeks. Come to find out, because her symptoms prompted her to go seek immediate medical attention through the emergency room, come to find out she was severely anemic. Hemoglobin was only 6.5. For those of you who are not familiar with that, don't worry. I'm going to explain all that and it's going to make sense. Just rock with me for just a minute. Hemoglobin was 6.5, so she gets admitted into the hospital. She gets subsequent blood transfusions. By the end of her hospital stay, she is feeling brilliant. Like she's feeling really, really good. She ends up getting discharged. She goes to follow up with her primary care like she's supposed to. She's feeling better, not quite 100%, but she is feeling worlds better. PCP says, you know what? Just humor me. Let's err on the side of caution and have you follow up with cardiology as outpatient just to make sure we're not missing anything. Fair. She comes to see me. We go through the whole story. I look at her lab values and all of her ER workup myself. I told her, I'm going to hit the finish line first, and then we're going to backtrack. She said, okay. I said, the finish line is you don't have a heart problem. You have an oxygen problem. She looked kind of puzzled, like, what? Are you serious? Huh? Bear with me. I said, stay with me. It's all going to make sense. She said, okay. Student nurses, new graduate nurses, this is your part where you pay closest attention. All right, pull up a chair. I said, there are two organ systems that are involved when it comes to making sure the body has what it needs as far as oxygenation. She said, okay. I said, you have the lungs, which are responsible for depositing oxygen onto the red blood cell, and then you've got the cardiovascular system that is responsible for transporting that red blood cell all over the body where it needs to go. Oxygenation by way of the lungs, perfusion, which is transport by way of the cardiovascular system. You with me? She said, yeah. I said, imagine, if you will, you remember going to amusement parks, or at least seeing amusement parks that have this really cool ride. It's called like a whitewater rafting kind of ride, where you have this giant raft that seats about a dozen or so people, and everybody's having a good time, and the raft just goes from the start of the course on to the bottom. It is really good times. So she said, yeah, I remember that. Did that as a kid. Imagine, this is the analogy I want you to grasp. That raft, metabolically speaking, inside the body, that raft is your red blood cells. She said, okay. Those seats, the number of seats that your raft should have as a female is 15. You should have 15 seats on your raft. And she said, okay. I said, that is your oxygen binding capacity. She said, okay. Your bodies in the seats, the people who were actually going to ride on that raft, that's your hemoglobin. Okay? I said each passenger should be wearing a backpack, should be carrying a backpack, and that backpack is full of oxygen that they got from the lungs at the beginning of this ride. She said, okay. I said, now let's put it all together. Your boat should have 15 seats. Your boat has 15 seats. What your boat, ma'am, does not have is enough passengers. You don't have 15 bodies in 15 seats. You have 6 bodies for 15 seats. And it's at that moment where you could see, like, her eyes got bigger, like, oh, she said, I don't have enough oxygen. I said, exactly. Exactly. You don't have a transport issue. I saw your workup at the hospital through the emergency room and EKGs and all that stuff, lab values, troponins, the whole nine. You don't have a transport issue. You have an oxygenation issue. I said, what do you think would happen if your organ systems don't get the oxygen that they deserve? She said, that's going to hurt. She said, no wonder I've been short of breath. Not enough oxygen is going into circulation. Bada boom, bada bing. You got it. You got it, ma'am. She said, why didn't my PCP recognize this? I said, your PCP did recognize this. They just wanted to make sure that they left no stone unturned to make sure your heart didn't suffer a hit or take a hit with undue or unreversible damage as a result of the poor oxygenation. I said, and that is fair. So we did an echocardiogram. Echocardiogram did not show any dysfunction of the heart whatsoever. She said, this makes perfect sense. What I do, I make it make sense. It is what I do. Short, sweet lesson for today, student and new graduate nurses, because I feel myself getting very excited and I got to calm down. Short, sweet lesson for today. Just because somebody presents with a complaint that seems cardiac on the surface, chest pain, shortness of breath, fatigue, that is not always indicative of a true cardiac issue. Do your due diligence and evaluate the situation in its entirety. From symptoms to EKGs to lab values, all of your lab values, whether it is your CBC, whether it's your CMP, your metabolic profile, your thyroid profile, the whole nine. Severe anemia means that there's not enough oxygen being transported throughout the body. It's not a transport problem. It's not a perfusion problem. It's an oxygenation issue. You see the difference? Good class, wasn't it? Hope y'all enjoyed this. If this face is new to you, please stay in the classroom. Hit that plus button right there. Join us for this, future sessions, and even scroll back in time to look at posts that I've already done. I guarantee you it's going to be very, very helpful. I am here for the long haul. Until next time, class is dismissed.